the level of L4 subdivides into common iliac. Common iliac artery gives internal iliac and external iliac, and this bifurcation is at the level of sacroiliac joint. External iliac artery below of inguinal ligament continues into femoral artery. Femoral artery, it passes through canalis adductorius, and this canal opens into popliteal fossa. And here it is, femoral artery in the region of hiatus adductorius continues into popliteal. Popliteal not necessary to prepare next time, just iliac and femoral artery next time. Internal iliac. Internal iliac gives parietal and visceral branches. First parietal branch, that is arteria circumflexa, arteria iliolumbalis. Arteria iliolumbalis, it goes to iliac bone and makes anastomosis with arteria circumflexa ilium profunda from external iliac artery, that is anastomosis between them. And arteria iliolumbalis supplies musculus quadratus lumborum, musculus psoas major, and musculus iliacus. Then next parietal branch, that is arteria sacralis lateralis. Sacralis lateralis. Today you already know what? Arteria sacralis media. And here it is arteria sacralis lateralis. Goes to sacral bone, to musculus piriformis, supplies sacral nevus plexus. Then next parietal branch is arteria glutea superior. Superior gluteal artery leaves pelvis through suprapiriform foramen and supplies musculus gluteus medius, minimus, musculus piriformis. The same, it supplies capsule of hip joint, that is arteria glutea superior. Next parietal branch is arteria glutea inferior. Inferior gluteal artery, it leaves pelvis through infrapiriform foramen and supplies musculus gluteus maximus and also participates in blood supply of hip joint. Next, here it is visceral, and next parietal is arteria obturatoria. Arteria obturatoria. Arteria obturatoria, it passes through canal, that is canalis obturatorius, and goes to medial side of the thigh and supplies medial muscles of the thigh, and also it gives ramus pubicus for pubic symphysis and ramus acetabularis. Ramus acetabularis goes to acetabulum and supplies head of the femur in hip joint. They are parietal branches of internal iliac artery. Now visceral. First visceral branch, that is arteria umbilicalis, umbilical artery. This artery goes to umbilical ring on anterior abdominal wall, and then continues to umbilical cord and goes to placenta in fetus. But after the birth, this artery closed, it's obliterated in most distance, and only in the beginning, here it is, in the beginning from internal iliac artery, it's present, and it gives branch, that is arteria vesicalis superior, which supplies urinary bladder, arteria vesicalis superior. And from this artery, from arteria vesicalis superior, we have ramus uretericus for ureter, and sometime from this artery start arteria ductus deferentis for deferent duct. In sometime arteria for deferent duct start from internal iliac artery, and sometime it start from arteria vesicalis superior. Next branch from internal iliac, that is arteria vesicalis inferior. It also goes to urinary bladder and supplies it. In male, this inferior artery gives arteria prostatica for prostate gland. In female, arteria vaginalis start from from arteria vesicalis inferior. Another visceral branch is arteria uterina for uterus in female. In male, I said about arteria ductus deferentis. Arteria uterina supplies uterus and it gives ramus avaricus for ovary, and this ramus avaricus makes anastomosis with arteria avarica from abdominal aorta. The same arteria uterina gives ramus tubarius for fallopian tube and ramus vaginalis for vagina. And next is arteria rectalis media. Arteria rectalis media. It goes to the rectum, and you already know today arteria rectalis superior from inferior mesenteric artery. Now we speak about arteria rectalis media. And last visceral branch, which also passes through infrapiriform foramen together with arteria glutea inferior, that is arteria pudenda interna, internal pudendal artery. Arteria pudenda interna leaves pelvis through infrapiriform foramen. After that, it goes to foramen ischiadicum minus and comes to fossa ischioanalis. And in this fossa, it gives arteria rectalis inferior. That is why rectum has three arteries. Superior artery, arteria rectalis superior from inferior mesenteric. Middle artery, arteria rectalis media from internal iliac. And arteria rectalis inferior from arteria pudenda interna. After that, internal pudendal artery gives artery for muscles of perineum, arteria perinealis, supplies muscles of perineum, and then it continues to genital organs and subdivides into two terminal branches. In male, it is arteria dorsalis penis and arteria profunda penis. In female, arteria dorsalis and profunda clitoris. That is all about internal iliac artery, and now external. I already said one branch from external iliac, that is arteria circumflexa ilium profunda, which anastomoses with iliolumbalis from internal iliac. And another branch is arteria epigastrica inferior, inferior epigastric artery. It goes to anterior abdominal wall and anastomosis with superior epigastric artery from what? Please.
Internal thoracic artery.
Yes, from internal thoracic artery. Superior epigastric from internal thoracic and inferior epigastric from external iliac. And the anastomosis and inside of vagina of rectus abdominal muscle and supplies anterior muscles of the abdomen. Sometime, it's too frequently, in 20-30% of cases, from arteria epigastrica inferior, we have ramus obturatorius. And this ramus obturatorius anastomosis with ramus pubicus from obturator artery. In this case, if we have anastomosis between ramus obturatorius from inferior epigastric and pubic branch from arteria obturatoria, it is dangerous in time of operation for femoral hernia. If we cut these arteries in anastomosis, we can receive bleeding, and it is dangerous for human life. And this anastomosis has name crown of the death, corona mortis, crown of the death. That is dangerous anastomosis in time of femoral hernia, in time of operation. That is all. Two branches, inferior epigastric and circumflexa ilium profunda from external iliac. And I already said that below of inguinal ligament, It passes through lacuna vasorum and continues to anterior surface of the thigh into femoral artery. That is femoral artery. Femoral artery gives some superficial branches. For example, arteria circumflexa ilium superficialis. It supplies skin in the region of lateral abdominal wall near of iliac bone. Then arteria epigastrica superficialis, superficial epigastric artery, supplies skin of anterior abdominal wall. And who remember what is the name of this artery? Internal pudendal. And from femoral we have external pudendal artery. This artery supplies skin of the scrotum or skin of labia pudenzi major in female. And next is largest branch of femoral artery. Who remember what is the largest branch in brachial artery?
Brachia profunda.
Yes, and here it is arteria profunda femoris, deep artery of the thigh. Arteria profunda femoris. This artery gives arteria circumflexa femoris medialis and arteria circumflexa femoris lateralis. And lateral circumflex femoral artery gives ascendens and descendens branch. Ascendens branch goes to hip joint and supplies capsule of hip joint. Descendens branch goes to the knee joint, to the network of the knee joint, and supplies musculus tensor fasciae latae, musculus quadriceps on the thigh. They are two circumflex, middle and lateral circumflex femoral arteries, and three arteria perforantes. Arteria perforanta, they pass through medial muscles, through adductor muscles, musculus adductor magnus, longus, and brevis, supply them. The same, they supply musculus gracilis, and goes to posterior surface of the thigh, and there arteria perforantes supply posterior muscles, biceps femoris muscle, semitendinosus, semimembranosus, and musculus popliteus. They receive blood through arteria perforantes from deep femoral artery. And last branch from femoral artery inside of this canal, inside of canalis adductorius, that is arteria genus descendens. Arteria genus descendens. It goes to the knee joint, participates in network of the knee joint, and this artery leaves canalis adductorius through anterior wall of this canal, that is lamina vasto adductoria. It perforates this lamina vasta adductoria and descends to the knee joint. Arteria genus descendens. My diagram only for your understanding. Internal, external iliac and femoral arteries, topography and branches. Listen to me, we have 15 minutes. I ask you to bring me model of perineum and some branches of internal iliac we can see in this model. Now, after 5 minutes, I come here and explain some arteries in model. Okay.